Today I want to do a cardiovascular and pulmonary assessment on my patient. While I'm talking to my patient, I want to inspect for the configuration of the thoracic cage, but also the symmetry of the shoulders and muscles while my patient is speaking and breathing. For this video, I'm going to have my patient turn and face this way. Everything that I'm doing on the posterior side, I would also do anteriorly. First, I want to palpate. I'm looking for masses and for tenderness. Again, I would do this anteriorly as well. While I'm down here, I'm going to assess for the expansion of his lungs. So having my thumbs together, I'm going to have my patient take a big deep breath in and out. And I'm looking for symmetric expansion of my thumbs. The next thing I would want to do is I want to auscultate the breath sounds on my patient. I would start with T1, 2, 3, 4, 5, 6, 7, and then coming out to the axillary line, I would assess 8 and 9. On this, I would have my patient inhale and exhale on each breath, or for each breath. Now I'm going to have my patient say some words for me as I listen. I'm going to have him whisper 1, 2, 3 on each side. Okay. Okay, and now I'm going to have my patient regularly say 99. And now I'm going to have my patient regularly say E, E, E. All right, thank you. And now I'm going to assess for tactile firmitis. On this, I would palpate in the 5 different spaces coming down across the lung fields. Now I have my patient say 99 in each spot. Again. Perfect, thank you. I'm going to go ahead and have you turn around, and I'm going to go ahead and assess my patient's heart. I'm going to start by assessing his valves. And starting on the right sternal border of my patient in the second intercostal space, I'm going to assess the aortic valve. And then coming across to the left sternal border in the second intercostal space, I'm going to assess the pulmonic valve. And I'm going to come down to the tricuspid and the mitral. Now while I'm down here assessing my mitral for a full minute, I want to assess my apical pulse in the 4th to 5th intercostal space. I would want to do this with the bell and the diaphragm of my stethoscope, but for the video I'm just going to use one side. And then while I'm right here, I would assess its apical pulse. And so while I still have my stethoscope on, I am going to go ahead and listen to his carotid artery, and I'm listening for a bruit. I would want to assess both sides. And now I'm going to palpate my patient's carotid artery, only doing one side at a time. That way I'm not pinching off any blood source to his brain. Right, and that concludes our cardiovascular and pulmonary assessment.